Kay Redfern Jamison was a senior in high school when her manic depressive episodes started. She said, "Once the siege began, I lost my mind rather rapidly." She wrote of how she raced about like a crazed weasel, bubbling with plans and enthusiasm, and staying up all night, night after night, out with friends, reading everything that wasn't nailed down, filling manuscript books with poems and fragments of plays, and making expensive, completely unrealistic plans for my future. Feeling as if she could do anything and that no task was too difficult, she said, "My mind seemed clear, fabulously focused, and able to make intuitive mathematical leaps." She also wrote of how the manic episode quickly burnt itself out and she came to a grinding halt, leaving her totally exhausted. This was then when the depressive phase of her illness set in, characterized by what she referred to as a grey, bleak preoccupation with death, dying, and decay, during which she said, "I thought obsessively about killing myself." Jamison was narrating her experience of mental illness in her now classical memoir, The Unquiet Mind. Hello, I'm Ibrahim Imam, and welcome to this episode of the Neurology Lounge podcast, in which we will be exploring bipolar disorder. Whilst in college, Jamison was also bedeviled by her capricious symptoms. She described going through periods of great fun, passion, high enthusiasms, and long runs of very hard but enjoyable work, during which she said almost everything was done to excess. Referring to her manic episodes as absolutely intoxicating states that gave rise to great personal pleasure, Jamison described how they were accompanied by an incomparable flow of thoughts and a ceaseless energy that allowed the translation of new ideas into papers and projects. After these exuberant periods, she said, "My mood would crash and my mind again would grind to a halt." During these spells of violent and dreadful moods, she said, "I lost all interest in my schoolwork, friends, reading, wandering, and daydreaming." Jamison highlighted the adverse effects of bipolar disorder in her life, describing how the disease incites dreadful behaviors, destroys the basis of rational thought, and too often erodes the desire and will to live. She particularly described how her mercurial moods and recurrent, very black depressions took a huge personal and academic toll during those college years. Worldwide, the prevalence of bipolar disorder is about 2 to 5%, and it tends to start in adolescence or early adulthood. There is a higher risk with urban living, a stressful life, and substance abuse. There are also some perinatal risk factors such as maternal smoking and intrauterine infections. Several genetic risk factors have been suggested, such as mutations of the serotonin transporter and the GABA receptor genes. Bipolar disorder continued to plague Jamison's life right through her professional career. For example, she wrote of how within 3 months of becoming a professor, I was a raving psychotic. This was when she said, "I gradually became aware that my life and mind were going at an ever faster and faster clip until finally they both had spun wildly and absolutely out of control." She said, "I was increasingly restless, irritable, and I craved excitement. But slowly the darkness began to weave its way into my mind, and before long I was hopelessly out of control. I was wildly agitated, paranoid, and physically violent." She also described her thoughts at the time, saying that they were so fast that she couldn't remember the beginning of a sentence halfway through it. Unlike Jamison, whose symptoms started in high school, Marya Hornbacher wrote that she had ridden her moods since childhood. Writing in her illness memoir titled Madness, A Bipolar Life, Hornbacher recalls that her mood disorder began when she was just 7 years old, and it started with severe despair, during which she said, "I cannot move. I burst into tears. I don't come out of my room for days. Days bleed into weeks. I lie in bed in the dark." It was, however, as an adult that she said the madness entered her for real. She described how her moods changed suddenly, saying, "One day I am calm and the next I am raging. It's very simple. Happens like you are flipping a switch." She added that I'll be going along in a perfectly good mood and suddenly I'll be lying in bed feeling like I'm dead. And then suddenly I'm up and running around. It's maddening. I'd give anything to be just normal for an entire day. Just a day. That's all I'm asking. During her manic episode, she said, "Everything is beautiful, simply gorgeous. I'm grandiose, delusional. I'm flinging my body about. I am, to the casual observer, clearly possessed." She would also manifest with rapid speech, saying, "I can hear my thoughts zipping and whistling through my head and see them snap and sizzle in streaking red lines on a complex grid that was designed by God and given to me personally." She also manifested with grandiosity, impulsivity, the feeling of complete invincibility, the absolute conviction that certain untrue things are true, snap decisions, shopping sprees, sexual promiscuity, dangerous driving, disinhibited behavior, and delusions, such as of being a millionaire high society lady who should be treated with the utmost respect. The main features of mania are elevated or irritable mood, increased energy for at least 1 week, pressure of speech, racing thoughts, heightened activity levels, goal agitation, risk-taking behavior, and reduced sleep. Mania can be euphoric, dysphoric, rapid cycling, that is more than 4 a year, or ultra-rapid cycling, where cycles occur every few days or weeks. Hypomania, on the other hand, is characterized by feelings of elevated self-esteem, distractibility, pressure to keep talking, excessive engagement in pleasurable activities, and psychomotor agitation. The features of major depression, on the other hand, are a depressed mood, loss of interest or pleasure, weight gain or loss, reduced or excessive sleep, feelings of worthlessness, fatigue, loss of focus, suicidal ideations, and significant distress and impairment. Hornbacher also experienced mixed episodes during which she said both the despair of depression and the insane agitation and impulsivity of mania are present at the same time. Another memoir that highlighted the contrasting features of bipolar disorder is that of Dale Zurawski, titled Bipolar, A Gift of Thorns. Zurawski compared the two elements of her illness when she said, "On my manic side, I was fun-loving, intelligent, and productive." She wrote that her mania was unpredictable, as she said, "It came out of the blue and left me crushed and disappointed." Conversely, she said, "On the dark side, I was angry and lashed out at family, friends, and even strangers." She further explained that the darkness didn't wipe out the good me. They lived side by side within the same person. But instead of depression, she said, my flip side was anger. I was prone to outbursts of aggression for no real reason. Zurawski's illness also manifested with alcoholism, drug use, and what she said was out of control promiscuity. Erica Nielsen was another person whose bipolar disorder manifested as anger. Writing in her illness memoir titled Sound Mind, My Bipolar Journey from Chaos to Composure, the professional cellist and music teacher said very early in her life she sought outlets for her rage. And she did this by fighting her brother or by hitting and kicking the family dog, watching her flatten her ears and skulk away from me, weeping afterward when I realized what I had done. Nielsen's anger persisted into adulthood when she said she may have angry, irritable, snapping outbursts where she lost all control. It was only later that Nielsen started experiencing the symptoms of depression. This was when she said my darkness, like a black cloud, would cover me from head to toe like a weighted blanket, and negative thoughts would flood my spinning brain, and a sense of hopelessness and guilt would paralyze me. That Nielsen also had mania only became clear after she consulted a psychiatrist about her depression, and he asked her questions regarding the symptoms of mania. This was when she recalled episodes of feeling elevated, euphoric, and invincible, with flights of creative ideas that would last anywhere from a week to months at a time, and which she said seemed to precede a period of depression. She also recalled episodes of scintillating indiscretions, of spending sprees, and of feelings of grandiosity, typical features of mania. A host of factors can trigger off episodes of bipolar disorder, and this is vividly portrayed in Hornbacher's story. Admitting that she engaged in many of these triggers, she said, I am guilty of every precipitating factor you can think of. No sleep, gallons of booze, not enough effort to stick with my medication. Due to the variable presentations of bipolar disorder, the illness is often misdiagnosed as other conditions. For example, Hornbacher was initially misdiagnosed as having an eating disorder and then as having depression. She also made the point that in the 1970s, most people with bipolar disorder were misdiagnosed as having schizophrenia, and in the 1990s as having unipolar depression. The main mimics of bipolar disorder are major unipolar depression, schizoaffective disorder, schizophrenia, anxiety, personality disorders, and even attention deficit hyperactivity disorder. The symptoms of mania may also be seen with such conditions as thyrotoxicosis, encephalitis, and neurosyphilis, and by side effects of drugs such as levodopa and amphetamines, and also by alcohol intoxication. It may therefore be important to carry out some investigations in the diagnostic process, checking for things like thyroid function, syphilis screening, and brain imaging if appropriate. Hornbacher was diagnosed as bipolar type 2. Bipolar disorder is classified into 5 main types. Bipolar 1, in which at least one mania episode with or without depression has occurred. Bipolar 2, in which at least one depression episode with hypomania has occurred. Cyclothymic disorder, in which depression and hypomania cycle over 2 years. And then bipolar disorder, not otherwise specified. There's also schizoaffective disorder, bipolar type. Another memoir that highlighted the propensity to misdiagnose bipolar disorder is that of Bridget Sheehan, titled Me and My Bipolar, Forever Together. Like Hornbacher, Sheehan was also initially diagnosed by her GP as having depression, and she was unsuccessfully treated with triptizol, a tricyclic antidepressant. This misdiagnosis is perhaps understandable, as Sheehan first suffered with recurrent bouts of depression, manifesting as not eating, not sleeping, trouble concentrating, and a sadness that I could feel in my chest. Indeed, her bipolar diagnosis was made only because her psychiatrist kept asking her if she recalled any high manic episodes. And although she said I could not identify any wild behavior such as excessive shopping, she nevertheless said she probably had mildly high periods before going into a depression. In some cases of bipolar disorder, the transition from one phase to the next could happen very rapidly indeed. This was the case with Meryl Hammond, who narrated her story in the memoir titled Mad Like Me, Travels in Bipolar Country. Hammond first manifested bipolar disorder in 5 fraught weeks during which she was making frenzied exertions to get justice for her child, a period which she said, in hindsight, was part of my first hypomanic episode. She said depression descended within 4 days of my admitting defeat, when she became listless and moody. She went on to manifest what she referred to as all the classic signs and symptoms of full-blown depression, a phase that lasted 6 weeks. She wrote that she felt completely melancholic and hollow, so joyless that she forgot how to smile and became almost totally disconnected from family and friends. Unfortunately, she said, what happened as I emerged from that first depression was in fact my second hypomanic episode. This was characterized by endless ebullience and constant high-speed chatter, irrational irritability, blind rage, planning to relocate the whole family to China, and then taking an exuberant road trip. It was shortly after this that she was diagnosed with bipolar disorder. She went on to have another bout of severe depression, followed by what she said was her first true manic episode. She described this as so many thoughts, so many new ideas, so much creative energy. My head felt like an overinflated balloon about to explode. She said, my main emotion during this time was elation. I was buzzing, fizzing, whizzing, bubbling, whirling like a dervish. Bipolar disorder, like many other psychiatric illnesses, has a familial tendency, and this was evident again in Hornbacher's case. In narrating her family history of mental illness, she remarked that crazy is nothing out of the ordinary in my family. For example, she wrote of her father's rages during which he is out of control and physically aggressive. And she also wrote of her uncle who was frequently admitted to mental health care facilities with manic depression. She had also had a family history of mental illness, her maternal aunt Sally, who she said had spent periods in hospital for it. Similarly, Dale Zurawski had a family history of mental illness, and she inherited bipolar disorder from her father. She said there were 2 sides to Dad, the scary one and the cuddly one. She wrote that episodes of mania in my dad came at an unpredictable frequency, like the flash floods from an invisible storm. Amongst the treatments Jamison had, lithium stood out for both its effectiveness and for what she referred to as her war with the medication. In his book titled The Disordered Mind, What Unusual Brains Tell Us About Ourselves, psychiatrist and Nobel Prize winner Eric Kandel traced the long history of the use of lithium to the Greek physician Soranus, who, in the 2nd century BC, treated his manic patients with alkaline waters, which are now known to be high in lithium. In her book titled The Drugs That Changed Our Minds, Lauren Slater credited the scientific application of lithium to psychiatric practice to the pioneering work of Danish brothers Carl and Fritz Lange, who used it to treat what was then called periodical depression. But the person Slater lauded for starting the process of entrenching lithium in the treatment of bipolar disorder is the Australian psychiatrist John Cade. She described how Kay had added lithium to help dissolve uric acid in the urine samples of his patients, which he was injecting into guinea pigs. This was when he serendipitously observed that the metabolites of lithium made his guinea pigs lethargic but conscious. Kay then self-experimented with lithium before he then successfully treated 17 of his asylum patients who had mania. Slater went on to describe how the medical community ignored Kay's findings for 3 whole years until the Danish psychiatrist Eric Kandel asked his colleague Mogens Strue to look into the matter. Strue proceeded to carry out a double-blind, placebo-controlled study, and Slater said that by 1959 he was able to report that he had treated in total 167 manic depressive patients with the drug, and that 77% of them had significantly improved. This positive outcome led to the wide adoption of lithium in psychiatric practice. Subsequent work has shown that lithium is also effective in preventing the depressive episodes of manic depression. Indeed, the effectiveness of lithium was evident in Jamison's case when she asserted that there was never any question that lithium worked very well for me. But, she said, I had become addicted to my high moods and have become dependent upon their intensity, euphoria, assuredness, and their infectious ability to induce high moods and enthusiasm in other people. It is therefore not surprising that she tended to voluntarily stop her treatment. The first time she did this was just 6 months after she started lithium. And what followed was what she referred to as 18 months of hell that culminated in a suicide attempt. Jamison emphasized that this resistance to taking lithium is played out in the lives of tens of thousands of patients every year. Zurawski also highlighted this tendency for people with bipolar disorder to go off their medication when their moods level out. Nielsen was also treated with lithium, but she asserted that in addition to taking my medication, my stability is rooted in 4 things: routine, sleep, good eating habits, and regular physical movement. Lithium, however, does not work well for everyone, and this was the case with Sheehan. She was first treated with lithium but then switched to carbamazepine and then to lamotrigine, which she said seemed better than the other 2. Hornbacher, on the other hand, was started on Depakote, and she said, by the end of the evening, a miracle has occurred and I'm feeling fine. Lithium remains the main drug treatment of bipolar disorder, but as we have seen, valproate, carbamazepine, and lamotrigine may also be used. Benzodiazepines may also be required for agitation and anxiety, and antipsychotic drugs for psychosis. Psychological treatments for bipolar disorder include cognitive behavioral therapy, family, group, interpersonal therapies, and peer support. Inpatient admission and electroconvulsive therapy may be indicated in severe cases of bipolar disorder. It is very reassuring that with the right treatment and commitment, many people with bipolar disorder live very fulfilling lives. For example, Nielsen said that it is not only possible to live with a mental health condition, it is possible to live well in every area of life, from your career to your relationships. Thank you very much for watching or listening to this podcast. If you found it enlightening or even entertaining, why not click on the like button? And better still, why not subscribe so that you don't miss the next episode of the podcast? Whilst waiting for that, you may want to check my website called Neuro Checklist, where there's a lot more information about bipolar disorder and other brain disorders. And you may also want to check out my book called Surfing the Brain, which is a light touch neurology. And why not join me in the next episode of the podcast when I will be talking to Lucas Klessig about his father's illness memoir titled Words with My Father. Do join me then. Thank you very much.